My name is Sherry Fox. I'm a bioarchaeologist, and I'm working on the Ashkelon project. Bioarchaeology involves the contextual study, that's the study of human skeletal remains as they are found in situ, in the field. Okay, and the first thing that we usually do is we have to determine if the bones are human or not. And I think most of you would be able to say, this does not look like a human bone. But not everybody. This actually belongs to a cow. It's a cow femur, the thigh bone of a cow. But not everybody would know that this is a human bone because it belonged to an infant. It doesn't necessarily look exactly like something like this, which I think most of you would be able to identify. It's the same bone as the cow too, but I don't have enough hands. So what the second thing we do, we've said it's human, is how many people are represented here. And this is pretty easy to say. We've got at least two. We're not going to count the cow as a person. So we have a minimum number of individuals here as two. Not only is the same skeletal element represented, but we have individuals of different ages. So we've got an infant here, and we have definitely an adult here. So after we do that, then we say something about the sex of the individual. Is it a man or is it a woman? Is it male or is it female? And the best place for us to look is on the pelvis. And here I have part of a pelvis of an adult individual. And one of the easiest ways we try to say if it's male or female is this area right here, the greater sciatic notch. And if I put my thumb in here, and I've got a bigger thumb than you do, I imagine, it can't wiggle very much, and that's a male pelvis. A female pelvis is much wider, and this is just one of the things that we look at. We look at the skeleton overall. We look at areas, for example, of the cranium, and I've got a cranium here. I've got a reach here. Excuse me as I get really big. Okay, and one of the things you should learn about when you're picking up a cranium. We want to show a great deal of respect and care for these individuals is you should always have a good hold down here, or try to have a good hold in the foramen magnum right here. Don't ever, if you're given a skull, try to pick them up with the eye orbits because the bones are very, very fragile in there and they'll break very easily. And the same goes for the nose. But what we do when we're looking at the cranium, and we can just from looking at the cranium, we can tell about 90% of the time if it's male or female. And this one, again, is very male. Got these nice, I wouldn't call them brow ridges, but supraorbital tori here. You can see in section, this is in the lateral view here, from the side, we can see these big bumps over the eyes. We also look at the back of the head, and when we've got big bumpy area back here, it looks more male. In this area right here, the mastoid process of the temporal bone, when it's big, it's male as well. Females tend to have what is called a more gracile appearance, less robust, less large and big muscle markings, and a smoother look to the forehead without these big bumps, and smaller area behind the ear and a smaller area back here.
And Sherry, my class studies a lot of times how people have changed how they look throughout history. Do you see that the brow bone has changed throughout history, or does it look the same on most of the people that you're finding?
You'll see differences with different populations, and you'll also see secular changes where men and women, during times of stress, where they're not getting enough to eat when they're growing, when children are growing and they're not getting enough to eat, like during war or famine, they're having difficult times or they're ill, you will see less difference between males and females. So less what we call sexual dimorphism. It's more pronounced when times are aplenty, when we have more to eat. Throughout time, do we see less in the way of brow ridges? I don't think so. Not really. Not from what I'm looking at, the time periods I'm looking at, more recent history. In some populations, it's more pronounced than in others. And it can have something to do with what you're doing as well. For example, if you're using your teeth to soften hides, you're trying to condition leather with your teeth, you're going to show a lot more muscle markings in the face than you would otherwise if you were not using your teeth as tools. So sometimes we'll see occupationally related differences between men and women as well. But in general, there's just a lot of variation, and we still see men like this. This guy's fairly recent, with nice big bumps over his eyes. As you'll be looking at people, say, he looks very male. Oh, she looks very female, as you're looking at them. So, in addition to sex and age is one of the more easy things that we do with children, because we look at dental eruption. We look at when teeth come in. First molars tend to come in at age 6, second molars at around age 12, third molars are more variable. The teeth tend to erupt at very regular times, even when times are difficult, and long bone growth lags behind, and it can lag behind for a couple of years. Teeth tend to erupt quite regularly. So we use dental eruption and development as a means for aging when we talk about children. Okay, so we've talked a little bit about human versus non-human. We've talked about minimum number of individuals, about sexing and aging skeletal remains. We've talked a little bit about dentition, something about skeletal anomalies. There's the retention of some teeth or different bumps on teeth or bones. And we've also mentioned some kinds of stress that you can see in the teeth. One of the things that I study are paleopathologies, or disease and trauma that you can see in bones and teeth. And I'm going to show this cow bone again because it's an excellent example of osteoarthritis, or arthritis that you can see in the skeleton of this cow. She was an adult when she died, but she had suffered from arthritis for some time. I don't know if you can see how shiny the bone is, but it's really very, very shiny. Whereas if you look at the distal articular area, it's very dull, more like what the bone should look like when it's healthy. In addition to all this shininess or eburnation, it's a definite sign of osteoarthritis. We've got all of this lipping of the joint area. See all that bony stuff? And we've got pitting on the articular head here of the femur. I don't know if you can see the pitting there, the holes in there. That's just a sign of arthritis. And we know, for example, in looking at the other side, this is the right hip. If we looked at the left hip, when we look at the left hip of this cow, she didn't have this condition on both hips, only on this one. And the rest of her skeleton looks pretty good. So the idea, we think, is that this was traumatic in origin. She was bumped. Her hip got bumped somehow, and it caused the cartilage to be damaged. And so it was a bone-on-bone rubbing. We can't say anything about pain. She may have been in pain. She may not have felt the pain, but we can see that she had arthritis for sure.
And Sherry, can you hold up the cow bone and the adult human bone just so we can see a comparison of the size? Oh, so yeah, pretty big difference. Very different morphology, as we say.
I'll show you this is the anterior surface, the front of the thigh bone with the hip joint here, the head of the femur. And I'll turn it. They're very different in morphology, but you can still see they're still very similar in some ways too. The cow bone is much bigger around. It's shorter too. I can't get the whole thing. If I backed up, I could see. Can you see how much shorter?
Yeah, I can really see it now.
Yeah, but a very different shape. Even though you can recognize it as a femur, it's a very different shape. So some of the other things that we look at in addition to disease and trauma, we look at sometimes post-mortem artifacts. And for example, we've got evidence in the pelvis here. You may notice something. What do you see that looks kind of different on this pelvis?
Does it look a little bit green?
It looks a little bit green, and that's a sign of cupric staining. And something copper was buried with this individual. And I think actually this individual may have had a belt buckle or part of a belt that had copper on it. Sometimes it has to do with the hands being in that position near the hands definitely fall down in that area anyway, normally, if it could be from a ring or a bracelet. But I think in this case it was probably a belt buckle. And that's where that green, it looks pretty, it shows up very clearly to me here. I hope you guys can see it too.
Yeah, so that happened post-mortem after the person died.
Post-mortem, after the person was buried. So even if the tomb that this man had been buried in had been robbed out, and the metals had been stolen, you could still tell that metal had been in there at some point. So it gives us a clue that something, some kind of copper alloy, probably a bronze or copper belt buckle, was on this guy. We also have, unfortunately, some trauma on the top of the cranium of this one from excavation injury, and that happens all the time, and this is really quite mild. But you can see, I don't know if you can see how white the area is here.
Mm-hmm.
That means it didn't happen before death or around the time of death. This happened much more recently. It's a recent post-mortem injury to that head. So it had nothing to do with how the person died. It had everything to do with what happened after death, sometime long after death. So those are just some of the things that we can say. One of the things that I like to look at is evidence for head shaping, for body modification. And humans are trying to change their shapes all the time with all different kinds of things that they do. Sometimes they show up skeletally as well. And sometimes we see them in human remains from, for example, tattoos. And sometimes we get in mummies. We get tattoos will show up. And we have evidence for that in Europe from the Iceman from the Alps in Austria. He had tattoos on his body from the Chalcolithic. So that's kind of neat. That was a long time ago, and people were even changing their appearance with tattoos.
And you can only see that if the skin is still intact, right? You wouldn't be able to.
If the skin is still intact, indeed. But something like foot binding, that will show up in the bones. Even sometimes corset. People that were wearing corsets, and at times, and it's been a fashion statement for men and women to wear corsets, and it may show up in the ribs if the ribs are preserved, that we can see something like that. But head shaping is one of the most common ones that we see from all different time periods and all parts of the world. People trying to change the shape of their heads, and we're still doing it today. We prefer babies that have very round heads, and so if they have been kept on their backs for too long and they've got flat backs of the heads, then the parents want them round, and they have devices that help make your baby's head grow rounder in shape. So we're still head shaping today, and it's interesting that different groups have done this at different times. Sometimes just women are shaped, sometimes it's met, sometimes it's both. Sometimes it's a sign of status, and only wealthy people are marked in this way. And but oftentimes these trends are adopted and they change over time, and they will spread. So a lot of people do different things with teeth too, with either knocking them out, with filing them down, with putting inlays into their teeth. From all over the world, they're doing different things with their teeth. And we see it today. Some people want a gold cap. Some people want a diamond stud. They'll do different things with their teeth as well. So it makes it interesting for identification purposes in forensic anthropology, but it makes it interesting culturally as well. What were trends at the time? What was common at that time? So it's a lot of fun. It's often, things look better in the ground than they ever do when you take them out. And it's fun to study them in context. So it's not just studying the bones, but studying them with what they were buried with and what kind of tomb they were buried in, or who they were buried with, at what time, and to better understand, if we cannot better understand where people were buried, and we can better understand how they were thought of when they were alive as well. So it's an interesting kind of thing, and you have to like puzzles and be a bit of a detective, and but I really enjoy it, and I hope that the students enjoy it too.